My name is Robert Rodgers. I am currently the clinical coordinator for the Maryvale Forensic ACT team. We work with individuals that are a higher acuity or their symptoms are more severe, and the standard level of supportive treatment has not worked for them. Any member that's been diagnosed with a serious mental illness and they have a criminal background, that's the forensic piece. So they come to our team for additional support in the community, where your regular supportive teams will see their members one time a month at their home. We'll go out and see them 3 to 4 times a week in their home. So the wraparound supports that we give them help them remain safe in the community and out of the hospitals, ideally. You can see walls come down when I share my story with people. I do that a lot of times, not only so that they'll trust me, but so that they know that I've been there and I'm not judging them. So it's a big part of where it helps them bring down the walls to where they're not feeling judged. When people haven't walked the life of recovery or been on the streets, we feel like we're being judged a lot by people that have not walked our life. So I can break down those barriers immediately. So I'm in recovery. I've been sober now for about 14 and a half years. And it's because of the individuals that helped me get to where I'm at. This is a lot of the reason why I want to give back to the community, so that people can see that no matter where you come from, what you've done, you can be whoever you want to be. You don't have to be stuck in this box of, this is just the way I was born. And outside of that box is an incredible life. And that's why I do what I do, because I want people to find that life that I found. The important thing to remember about my story is going to be that this is a story of recovery and not so much of the dark stuff in the past. If anything that I ever want to convey, it's that recovery is possible. So I was born into a small town in Illinois called Sterling, Illinois, where I was just born into all kinds of abuse. I mean, we're talking drugs, alcohol, physical, sexual, and this is a generational thing that was happening in my family. We moved to California. When I was in California, it was discovered that the police department or somebody found out what was happening in my family about the abuse, and then we were removed from the home and I was placed in foster care. That was at the age of 6. From the age of 6 till I was 12, I lived in a home, foster home, where they were physically abusive. I started using drugs and alcohol when I was 12 years old to numb the pain of my childhood. When I turned 18, it just escalated. From the ages of 12 till I was 42, there were a lot of blurs and dark ages. I did some crimes in which I got in trouble for. That helped me get sober. I was standing in front of a judge one day at 42 years old, and he told me that if I didn't go to treatment, I was going to be going to prison. I went to treatment. Unfortunately, that 2 weeks before I got into treatment, I had an awakening in my life. Took a deep look at myself and said, I didn't want to live like this anymore. I didn't want to be an empty, shallow person that I was. Where my only goal was to seek and do drugs, do things to get drugs. I completed the treatment program. I stayed at the treatment program for a total of 4 months, and I got jobs. I started going to college. I got my associates, my master's, my bachelor's, all with honors. And now I get the privilege of, it's because of those individuals that were in that treatment facility and the many people in the AA programs and any of the 12-step programs that helped me get to be where I am today is a lot of reasons why I want to give back and help others. When I was in treatment, I went there as if my life depended on it. And I laid everything out that I had to lay out so I could stay sober. I was scared to death. I had no idea who I was sober. Treatment gave me a new life and an understanding of who I can be. I always knew that I wanted to go back to school. When I went into treatment, I was thinking I wanted to be a software engineer because that's where all the money is. They make a lot of money. It was there that, and doing some soul searching and just talking with the other people there, that I realized that I wanted to be in this profession, into behavioral health and help others. Everything that I've been through in my life prepared me to be who I am, the professional that I am today. Within our organization, I wanted people to know that the person that you're working with today can be your coworker tomorrow. I want people to always keep that in mind, because without the beautiful people that help me, I wouldn't be where I am. I love my job. I love what I get to do, and love that I get to come in and help another person. All of us deserve someone to help. We deserve that help. Just because we end up on the streets, just because we end up homeless, it's not who our dreams were growing up. Just what life dictated to us. Do I wish I would have never been a drug addict? Do I wish I would have never picked up a drug? Sure, I do. But that's not my story. My story is filled with, a tragedy and triumph. And now I get to take all of that and use it to help other people. That's what gets me out of bed. Because I want people to have the life that they deserve.